Number 6 is the interesting case. This is a patient who had mental status changes and was HIV positive. And this is the T1 weighted sagittal scan showing the lesion on T1 weighted scan, and then the T2 weighted scan, axial scan. Again, HIV with mental status changes. This is a blow-up of that T1 weighted scan. And I believe I have the blow-up of the T2 weighted scan for you to observe. A little higher look. And finally, we have the flare scan with the post-gadolinium T1 weighted scan. Let you cogitate for a moment on that. Okay, in this HIV individual with mental status changes, what would you say is the most likely diagnosis? Is this progressive multifocal leukoencephalopathy? Is this normal variation? Is this a manifestation of toxoplasmosis? Is this a manifestation of cryptococcus infection? Or are these representing lacunar infarctions? Let's start the timer here. Again, PML, normal variation, toxoplasmosis, cryptococcus, or lacunar infarction. All right, so this is a little bit more difficult case. Number 4, cryptococcus, is actually the correct answer, and I congratulate the 68%. One of the things that I know that most people were considering was enlargement of perivascular spaces, the so-called Virchow-Robin spaces in this individual. And the reason why I showed this flare scan was to try to suggest that the signal intensity here is a little bit brighter than that of the signal intensity of the cerebrospinal fluid, which would argue against this being merely Virchow-Robin spaces. So, and the same is true on the T1 weighted scan that was shown. So let's talk about cryptococcus. What would you say is the most common finding in individuals who are diagnosed with cryptococcus meningitis or cryptococcal infection? Would it be a normal study? Would it be dilated perivascular spaces? Large gelatinous tumors, hydrocephalus, or none of the above? Start the timer. Most common imaging finding in patient with cryptococcus. Would that be normal evaluation, dilated perivascular spaces, large gelatinous pseudotumors, hydrocephalus, or none of the above? The correct answer here is indeed normal evaluation. This is often a diagnosis that's made through the CSF diagnosis, and quite often we see nothing of patients who have cryptococcal infections. If we were to see imaging findings, the most common is going to be number 4, actually, hydrocephalus. Dilated perivascular spaces may occur in cryptococcus, and in fact, these large gelatinous pseudotumors often will occur along the perivascular spaces. Cryptococcus may have many manifestations within the cerebrospinal, within the central nervous system, which include meningitis, encephalitis, abscess, or these cryptococcomas. It is number 2 after toxoplasmosis as far as infections go. It's just that our imaging, typically, we see nothing. As I mentioned, the gelatinous pseudotumors occur along the lenticulostriate perivascular spaces, and these may look initially on a T2 weighted scan like perivascular spaces, but again, when you do flare scanning or your T1 weighted scanning and adjusting the TE, you will see that indeed they do not represent cerebrospinal fluid spaces. When you have more advanced cryptococcal infection, you may have a miliary nodular pattern in the brain, and they may include subarachnoid seeding into the spinal region. Choriplexitis would be another manifestation of cryptococcus. Now, this is a individual who was totally asymptomatic, was not HIV positive, was cryptococcus negative. This is an individual who has just markedly dilated perivascular spaces when you look at this on T2 weighted scan as well as in individuals on the flare scans. When you have dilated Virchow-Robin spaces, there's a relatively broad differential diagnosis. It is seen increasingly with increasing age, as well as in individuals who have hypertension, and it's thought to be due to this vascular ectasia. The differential diagnosis would include your small vessel ischemic disease. And there have been studies showing that dilated perivascular spaces do correlate with cognitive decline over time. The pathologic conditions that may be associated with dilated virchow robust spaces include these cryptococcal infection, again, thought to be due to gumming up of the perivascular spaces and dilatation. Can be due to, we see this in sarcoidosis, and some of the mucopolysaccharidoses will also cause marked enlargement of the perivascular spaces. Again, the reference here is from last year's AJNR. We're up to case number 7.